Nicole, are you ready to give meds?
Can I have like 5 more minutes?
Yeah, I have something to do. I'll be back.
Okay, great. Thank you.
So Nicole, today we're going to review your patient's medications before we go into the patient's room.
Okay.
Once you go in your patient's room, I know this is the first time you've given meds, but I'd really like you to take control there. You know, I want you to feel like this is your patient and give meds with your patient as if I'm not even there.
Okay.
So let's prepare you before you go in the room.
Great.
Because I think that will help with your confidence.
Okay.
So you have the meds here and you've done your first check?
Yes.
Okay. So let's go check them again, and then our third check will be when you're at the patient's bedside.
Excellent.
All right?
Yep.
So can you tell me a little bit about Colace?
Sure. Well, I will be giving my patient Colace. I'm giving 100 milligrams PO. Colace is a stool softener. It's indicated for constipation, and it's an osmotic stool softener, so it brings water into the patient's colon to soften the stool so it's easier to pass. It is important to give because patients often get constipated from the stress of hospitalization, unfamiliar territories, they're not used to going to the bathroom there.
That's true.
And also, if they're on any opioid painkillers, it can also bind them up.
Okay, and your patient is, so.
Yes.
So in your morning assessment, did you ask about his bowel movements today or in the past day?
Yep.
And did you assess his bowel sounds?
Yes, he had positive bowel sounds in all 4 quadrants, and he has not stooled in 2 days, and I also got that from report this morning.
So that would be a good thing to give him.
Great.
Good job, that's really good. Okay, did you check that? Let's check those.
Yep.
Okay. So that's our second check, yep. So what else are you giving?
I am giving 325 milligrams of aspirin.
Okay.
This is for his fever. It helps bring down the fever for him.
Okay, let's just talk about that for a second. Look at how often the aspirin is given on your patient. How often is that?
Just once daily.
Okay, so what other action does aspirin have?
It is an anticoagulant.
Well, it's a platelet aggregate.
Okay.
Okay, so your patient has a significant cardiac history, and a dose that's given once a day, then we're using it more as a platelet aggregate rather than a fever reducer. So it's important to look at that timing on that. So if I'm using that as a platelet aggregate, what would be one of my parameters that I might want to look at?
I want another platelet count.
Correct. So what would normal platelet count be?
150,000 to 450,000.
Exactly, and you see he has a platelet count of
200,000.
Okay, so, you know, this is perfectly fine within the norm for him to have, and it would be good cardioprotective for him.
Great.
Good job.
Okay. Next, I will be giving atenolol. I'll be giving 100 milligrams of this, PO.
Okay.
This is for the hypertension.
Okay.
My patient has hypertension.
Okay.
It is a beta blocker, so it works as an antagonist at the beta-1 receptors on the heart.
And atenolol, is this a long-acting beta blocker or short-acting beta blocker?
This is a long-acting
How do you know that?
because I'm only giving it once.
Because you're giving it once a day. Good job. Yep. So what kind of assessments would you want to do prior to giving that, or what did you do?
So this morning, when I was taking the vital signs, I took my patient's blood pressure, and it was 150/80.
Okay.
And so if it was less than 100, then I wouldn't give it.
Do you have any orders for that, or is that just in your book? Because sometimes you get orders for that, but you don't have orders.
Not for the specific
So
patient.
if it's
no.
under 100, we could either call the doctor or we could make that call.
Sure.
Or let the nurse know.
Okay.
Okay, but obviously his blood pressure's fine.
Yep, and his pulse was 2.
Okay.
His pulse was 85 this
Okay.
morning.
And regular. Did you listen to that apically?
Yes, I did.
Okay. Good. And then you have one more
I do.
antihypertensive.
I'm giving lisinopril. I'm giving 40 milligrams of this PO.
Okay.
And this is also an antihypertensive. This one, however, is an ACE inhibitor, so it works in the renin-angiotensin system.
Okay.
Involves the kidneys.
So that's different, obviously, how it works. So what are some of the things that you would assess differently for this medication?
Well, For this one, I would want to know my patient's BUN and creatinine levels,
Yes.
just to make sure that his renal function was good.
Good. And it looks like, and you know what the normal BUN is?
The normal BUN is 10 to 20.
Okay. And creatinine?
Creatinine is 0.5 to 1.2.
Yeah, and it looks like your patient's BUN and creatinine is just fine. So what about the fact that we're giving 2 different types of antihypertensives at the same time?
Well, I would be concerned that perhaps it would drop my patient's blood pressure significantly, so I'd want to be more careful when I'm getting him up, perhaps, so he doesn't fall.
Yeah, absolutely, because this can cause his blood pressure to change quickly.
Right.
Especially if you give these at 9 and then you go do a bed bath and try to
Right.
get him up and moving.
Right.
Well, and think about these 2 medications on your medication reconciliation were ordered at home. So these are not new medications for your patient. He's used to taking them every day. So the likelihood, if he takes them both at 9 in the morning at home every day, then the likelihood that he's going to get really hypotensive is unlikely. However, he's in the hospital,
Okay.
and his condition is not as stable as he is at home. So you definitely want to assess for that.
Great.
So just some things to think about.
Absolutely.
So Nicole, now that we've gone over your medications, we're ready to go and give them to your patient.
Great.
I think you're ready. So what I want you to do is I want you to go into your patient's room and I want you to be confident because you know your meds, okay? Feel free to refer to anything that you need, but go in there and I want you to give meds as if it's your patient, which it is. Okay, so tell me some of the things that you're going to do once you get in the patient's room.
Okay. Well, first, I'm always going to clean my hands because hand hygiene is important.
Perfect.
And then I want to make sure I have the right patient, even though I already know my patient.
Right.
It's important in medication administration to check his wristband and also ask him to give me his full name and date of birth.
2 identifiers, exactly. That's great.
And then I'll do my 3rd check. So as I'm administering the medications, I will make sure that I have the right pill in my hand and I have the right dose and I'm giving it the right route. And then I'd like to ask my patient a little bit about the medications and make sure that he understands what he's taking and why.
Now make sure you're not quizzing him, okay? Sometimes, patients don't want to be like, hey, do you know your med? You're really in the teacher role. So really embrace that. Even if the patient already knows about their meds, I'm sure you're going to tell them something that's new.
Okay.
So definitely get in there and tell them some of the things that you told me.
Okay.
Okay?
Yeah.
I'm just going to step back and let you run the show, okay? Because I really feel confident that you know your medications.
Okay.
Okay?
Great.